Hi, and good day. This is a very important video that I hope you really take very serious. Why? Because the majority of us, as a result of prolonged sitting, poor posture, being overweight, having weak core, doing activities day after day, our normal activities of daily living, doing things incorrectly puts a tremendous toll upon the pelvis. As a result of that, the pelvic bones, which is you can see here both pelvic bones here. This is the sacroiliac region. The pelvic has a tendency to shift. So in other words, when we walk, the back of the pelvis rocks like this as we walk. These are called the sacroiliac joints. Here's the ilium on both sides. Here's a sacrum that sits in between. And these particular joints work independently. Okay, if you look at, this is the back of you. This man is facing, the spine is facing towards me. So if we're looking from the back, this is going to be his right side. It's going to be his left side. Now, when we look at the right sacroiliac joint, this pelvic can go forward like this. And as it goes forward, the leg goes further down. As the pelvic comes back, the leg comes further up. So if this goes back, this right side goes back, and the leg comes up, the hip joint comes up, making the leg shorter on one side than the other, this pelvic can still come forward on the other side, bringing the leg down. So as a result of this, we get an unequal balanced leg length. Now realize this is a mechanical leg length, a mechanical alteration of an imbalanced leg. This is not a genetic type of thing where one person has a leg born, where they were born shorter than the other. This is a functional, muscular, skeletal imbalance as a result of muscles that are pulling unequally on the pelvis, into the hip, affecting the lower extremity as well as moving up into the abdomen and upper mid-back area. This becomes imbalanced where one pelvic becomes off, making one leg become shorter or longer. So this particular video, I'm going to show you 3 main stretches to help a significant, a high majority of these particular problems can be helped naturally just by doing these 3 main exercises, these main exercise stretches that I'm going to show you. It's going to entail the gluteus medius. The gluteus medius sits in between the gluteus maximus and minimus, and this sits in between, and this actually affects the hip abduction, bringing the hip outwards, and will affect internal and external rotation of the hip. Now, just standing on one leg has a tremendous effect when it comes down to shortening, contracting, lengthening, because it plays a major effect when it comes down to altering on one side of the body. Okay? The other one is called the piriformis muscle. Piriformis muscle is an external rotator attaching from the hip, the femur, coming across the femur from the sacrum. All right, so this kind of runs on a diagonal under here, and the sciatic nerve comes underneath that particular muscle, and that can cause pain going down the leg, called sciatica. And the other muscle that we're going to stretch, simply that you know of, the hamstring muscles, which is behind the thigh, that attaches to the back of the ischium and goes down behind the knee, and that can rock the pelvis back, causing posterior pelvic tilt, and that is a key muscle as well. Not only that, but that will actually affect the flexion of the knee, bringing the ankle closer toward the buttocks area as it contracts. So let's go on and move on with these stretches I'm going to show you, and you're going to do these stretches at home, all 3 of these, and hopefully this can make a big change with that constant pain you're having in your lower back, maybe from discs, herniations, pinched nerves, piriformis syndrome, sciatica. But when this pelvic becomes altered, where you may feel as if you're standing a little higher on one than the other, you may feel like you're off, you may feel like something's not right. There's a lot of other mechanical things that can cause this, but this is the most safest thing for you to do first, and hopefully this can help you. We'll start out with the easiest muscle called the hamstring stretch. You'll always do both sides of each muscle. The stretches are generally going to be about 30 seconds per hold. You can do a couple sets of them, but the most important thing in any stretch you do not ever bob, do not ever push too hard. If it's too much pain, then let off. Obviously, when you stretch, you're using muscles that have not been stretched. So as you stretch them over time, you'll notice you'll get more range of motion. All right, so you can sit on a couch, a bed. I like to keep one leg off the bed or the couch. Keep the knee straight. I like to push pressure on the knee. And I just like to lean forward. As I lean forward, you'll feel the back of the hamstring start to stretch, and it starts to hurt a little bit. I just hold it there. Hold it a good 30 seconds. Okay, don't force it, don't bob. And obviously, as you stretch, as time goes on, you'll be able to go further and further and further. Don't worry about how far you go. Just make sure you're holding that stretch. And then what you'll do is you'll switch legs. Very simple. Same stretch, hold the knee down. Feels nice though. You're saying, ow, ow, ow. You may be up here when you're stretching. It's okay. Just get to the point to where it hurts and hold it a good 30, 40 seconds. And do a few sets of, again, each of those muscles. That is the hamstring stretch. Now you actually should be feeling it underneath the buttocks as well, because remember, it is attaching behind the pelvis. And that's part of the pelvic problem because that's pulling the pelvic backwards and posterior tilt. Okay? So that will actually relax a lot of the pelvic as well as behind the knee. Since you're on your bed or on the floor, the next one will be the piriformis stretch. Very simple stretch. This is going to actually open up the piriformis, relieve a lot of the pressure from the sciatic nerve root as well. If you're having sciatica, I recommend you definitely do this. What we're going to do here is that we're going to cross our leg like this. And as our leg is crossed, we can actually, if we just lean forward towards that ankle, you'll feel the piriformis stretch. If you don't want to lay down, you could just cross the ankle and just lean forward. Preferably, you want to sit a little bit lower to where the knee is at least horizontal with the hip, or maybe a little higher up than the hip joint. But as I'm showing you here, you can just lean forward towards the foot. You're going to feel it. You can cross this way, and if you lean towards the foot to the left, even if no matter how you're sitting, you're generally going to feel that muscle become tight. Lying back, you're just going to lay back. You're going to put it behind the leg as if you were sitting up. And you're going to grab underneath that knee and pull towards you. I'll come on a different angle here. Okay, you can see I'm pulling up towards me. You'll hold that a good 30 seconds. And then obviously you'll cross and you'll do the opposite one. Okay, but hold that stretch a good, 30, 40 seconds. Do a couple sets of those. Will really release that. The gluteus medius stretch, very simple. We're going to actually open up that whole side of that hip area. We're going to cross the leg, over the leg like this. And we're just going to pull it over. Okay, you can put your arm here if you like, put it here if you like, but really pull that over, and you're going to feel the whole side of that buttocks really rip and really stretch. Very simple. Take the other one and just pull it all the way over. You'll feel that whole side of the whole hip buttocks region really open up and stretch. So remember, these sacroiliac joints, the ilium, work separately on each side of the body, and they can be altered as a result of imbalances going on with those muscles. You have muscles that are abducting, muscles that are internally, externally rotating. You have muscles that are pulling backwards on the pelvis. There's a whole complexity of different things going on. So before you take the sledgehammer and start banging away, use that fly swatter, these exercises that I'm teaching you, the simple, most conservative route. Do these three together, and you'll see in most of these situations that pelvic will free up. You'll start regaining that normal mobility. Many times that pelvic will balance out perfect. You may notice that you feel as if you're a little imbalanced when you're walking on one side of your body than the other, but after you do these stretches, you'll say, wow, do I feel different? And that's what you're looking for. Things that change are the things that heal. Share this video with those that can benefit. Subscribe if you haven't. Any messages, please leave them below. And most important, make it a great day. I'm Dr. Alan Mandell.